individuals, 1 extra whole work week per year. It's easy for you to calculate what the average hourly wage or what the average salary is of your workers and see that extra productivity that is going out the door as these numbers increase each year in your organization. If we look specifically at the risk of workers' compensation based, again, categorizing your workers by weight class, Alcoa did a nice study of 5 different plants that they have in the eastern part of the country, looking purely at the odds of one of their workers in one of their foundries and other plants incurring an acute strain or sprain that then became a compensable workers' compensation claim, all other things being equal and accounted for in the study. There was, again, a linear, statistically significant increased risk of having that strain or sprain that became a comp claim purely because of the variable of obesity, to the point where 3 to 4 times as likely doing the same job, the same work, the same worker, same age, same other factors, that much more likely to have a workers' comp claim. In my own division at Duke, we looked at 12,000 workers' comp claims of Duke employees over a 3 or 4 year period. We have about 34,000 employees at Duke, mostly in healthcare, but plus all the university side. And we did a similar look at type of injury and stratifying all the employees who got injured by their weight group to look at what that odds ratio is of the weight causing an increased likelihood of having a compensable workers' compensation claim in North Carolina. Almost the same exact odds if we look at pain or inflammation, which are the black circles, or sprain or strain, the white squares. It's a nearly 2 to 3 times increase as you increase the weight of the workers. We know that this is accounted for by weight because if we look at other things that are acute injuries that should have nothing whatsoever to do with the employee's weight, such as needle sticks in the emergency room that nurses and MAs and doctors get, lacerations based purely on an accidental basis, those are perfectly flat. So we know that all of the other variables are well accounted for. So this is just, these 2 studies show the increased risk of having a workers' compensation claim due to obesity. What's more dramatic is what happens then once that comp claim starts. And this is where some of you, I'm sure, have had discussions with your brokers and with your benefits managers and safety managers over some of these numbers that you didn't understand why they were increasing so much. So if we took in the Duke study the workers who had the workers' comp injury, and then we looked at the duration of the claim, the total number of lost work days, the total number of dollars spent, and there are 3 of us doctors and 1 physician's assistant who took care of every one of these 12,000 patients. So we know that every other factor was held even and accounted for in the study. If you compare some of these factors in what we consider normal BMI or the non-overweight, normal weight individuals with those with similar injuries in higher weight classes, we went anywhere from a 7 times increase in medical costs to a 13 times increase in lost work days, accounted solely because of the increased weight class in the morbidly obese group. So the math does not work out this way statistically. You can't do it. But if we had a 3 times increased risk of having a comp claim, and then a 13 times increased risk of a lost work day, you're looking at almost a 40 times increase in lost work days in morbidly obese individuals doing a certain job versus normal weight individuals doing a certain job. 40 times increase. If there was any toxic chemical or any other thing in your workplace that OSHA or some other federal agency could say, that's causing a 40 times increased risk of some bad event happening, that plant might be shut down that day. But because this is such a more difficult issue that is more inherent in the worker that comes, and we can't identify what exactly is causing the injury and what day they're going to have it, it just kind of becomes part of the way we're doing business. And we don't have a way to account for this. We don't have a way to prevent this from happening yet. A research group followed this to the next logical conclusion to say, okay, once you've got a claim, let's look at the total duration and cost of that claim, match claim for identical types of injuries. And as a workers' compensation claim continues on down the road, once you get to 3 years and then 5 years duration of a claim, so these would typically be backs and knees and other shoulders and other high-dollar, long-duration workers' comp claims, then you're looking at somewhere in the range of 5 times the cost of the claim, all other things being equal, over the whole duration of the claim. So clearly, as the prevalence of obesity goes up, and you're wondering why, even though you're doing all the other right things, why your workers' comp premiums are going up, and I don't know the Kentucky system well, so I don't want to, you may have done some great things legislatively in the comp system here lately that I'm not aware of, but this is one important reason why workers' comp is such a difficult thing to get your arms around, and why it's so hard to understand why exactly these changes are occurring, even though we're doing all these important legislative things to try to hold down the costs. So one kind of theoretical model to look at why these different personal health risk factors have become so difficult in the workplace. 30, 40 years ago in occupational medicine, you were exposed to asbestos or you weren't, or you were exposed to silica or you weren't. And it was very clear, it was very delineable to determine whether or not what system you should be in. More and more now, the health of the worker that you put into a particular job position is the real determinant of whether or not they're going to have a high-dollar, expensive, or permanent workers' comp claim, more so even than all of the great safety advances and the exposures and the doses they may actually get in the environments that you have in your organizations. So there are lots of different ways that obesity or any other personal health risk factor can come into play to determine someone's ability to do their job. It can be a dependent variable, an independent variable. They can cause two separate problems that then increases someone's risk for not being able to do the job that you've hired them to do. Lots of different ways they can come together. Some of you may have heard about a couple of concerning workers' comp cases from around the country that may have some of the attorneys and the workers' comp carriers in Kentucky a little bit concerned. There was a case in Oregon a couple of years ago where a truck driver got injured, needed a knee surgery, eventually got back to work as a truck driver for another company. During that interim between those two jobs, he gained about 100 pounds, had another workers' comp injury, but then at that point he was about 300 pounds, needed a knee surgery. The orthopedic surgeons said, we're not going to operate on your knee because it's too much of a surgical risk, so you need to lose weight before we can operate on your knee. It became a fight between the workers' comp carrier of the new employer, the old employer, and the group health plan to see who was going to have to pay for the medically necessary gastric bypass surgery so that the person could then be thin enough to be a good surgical candidate for the knee surgery under the workers' compensation claim. So the Oregon courts struggled with this and eventually said, we can't say directly that the first injury back in 1976 caused you to be obese, because obviously it's a multifactorial issue. But we do know that because the doctors say we can't fix your compensable problem until we take care of a separate health issue, that the workers' comp carrier for the current employer must pay for your gastric bypass surgery so you can then have the second surgery. So this got the whole workers' comp community up in arms, as you can imagine, over this. It may be less of an issue if you are a completely self-insured employer for both workers' comp and group health. And in some states where the company has a whole lot more control over a comp claim, it may actually lower the total amount of missed time and cost. But still a scary confluence of the two-headed system that we have, workers' comp and group health plans, and the fights that are going to ensue over what caused what and how do we sort it out so we can get this guy back to work eventually. And there are other cases like this around the country. One very close in Indiana, where a guy who just started working at a pizza shop got hit by the freezer door, went out for his back injury, out of work for 3 months, gained 40 pounds. Same thing. He couldn't have the back surgery because until the doctors said that he had his gastric bypass surgery.